Did you know almost 1 in 15 American adults suffers from depression? The tragic death of Robin Williams has certainly gotten people talking about mental illness and how to deal with it. Dr. Jamie Kulaga is here now to talk about how to recognize depression and ways to treat the disease. Dr. Kulaga, good to have you back.
Thank you. Thank you for having me.
Let's talk about the signs of depression.
Okay, well, depression is a clinical diagnosis, and you're going to see symptoms of hopelessness, changes in eating, changes in sleep, and then you're also going to notice people might be withdrawing from activities that they like. One thing that's important to note is that depressive symptoms, like people wonder, am I sad, am I depressed? That depression is going to last for longer than 2 weeks, and it's going to be most days, most hours of the day. But the list of symptoms that I just gave you, women tend to follow them, whereas men might show different symptoms such as aggression, anger, hostility, and definitely they withdraw.
How much does depression affect somebody's energy level?
A lot, because when you're sad, you have the ability to rebound into doing things very quickly. With depression, you don't. It's been weeks of this sadness and your inability to get up and do things.
Why do some people have such a hard time reaching out and asking for help with this?
I think if you look back at the counseling and psychology field, the history of it, it's had a negative stigma and connotation associated with it. We call therapists shrinks and things that we might joke about, but it's just very negative in nature. Also, especially with little boys, and we might with girls, but with boys, when they're very young, we tell them, you know, be strong, stop crying, it's okay, back down, you know.
Yeah,
and
right.
they're stuffing these feelings down. And then years after years, that becomes the pattern. And then they're just, I mean, that cycles into depression and anger.
Well, let's talk about treatment because,
Okay.
I mean, we mentioned Robin Williams off the top.
Yep.
He was seeking treatment
Absolutely.
when this terrible tragedy, and he took his own life, which I'm sure is very discouraging for a lot of people to hear that he was getting treatment. But there are treatments out there, and there's a wide variety of treatment.
There is. First and foremost, I'm huge on prevention. So just taking a step back for a minute, if you can prevent it, noticing changes in family members, your teenagers, different, you know, when they withdraw from activities and things that they like, trying to catch that. I'm both a life coach and a therapist. When people come to me for coaching, they're coming with, you know, goals in mind, motivation, but when sad bouts come in, we can catch them quickly before they spiral into depression. So, and then of course teaching younger boys to open up and things like that, and who they can cry to and who they can talk to. Separate of that, once you have been diagnosed with depression, you know, it is both situation and chemical, so you could treat it with medication. But in addition, exercise releases endorphins. Endorphins make you happy, they boost your mood. Changes in nutrition. 90% of serotonin is made in your gut. So, and serotonin is what makes you happy.
Right.
So if you're eating processed foods and junk foods, it's harder for the serotonin to distribute through your body. And then something people overlook is the creative side of things. Journaling, painting, going out and doing sports, things to release.
Have an outlet.
Yeah, exactly, have an outlet.
All right, well, get help. And if you notice somebody that is going through this, get them help, right?
Absolutely.
All right, Dr. Jamie Kulaga, thank you so much.
Thank you for having me.
We'll be right back.